AL is a 15-year-old boy who arrived at the clinic with complaints of a cough and mild occasional chest tightness. He reports that the cough started about a week ago and that the cough is productive of a green phlegm. He says that the cough is worse at morning and at nighttime and also when he's exercising. He is currently playing on his high school football team and has been having practices every day this summer and will continue to have practices every day while he starts school because it is football season right now. He also reports that it is difficult for him to take a full deep inspiration. Usually that does cause him to begin coughing. He has never had these symptoms before. He denies smoking and he also denies any family history of asthma or known respiratory problems. The patient also denied any fever, chills, rhinorrhea, shortness of breath, ear pain, and headache and nausea, vomiting, and diarrhea. The patient has no known drug allergies and is not taking any medications daily. The patient's vital signs were all within normal limits except for his temperature, which was slightly elevated at 99.1 degrees Fahrenheit. In the physical exam, the patient looked good in appearance. He was not in any apparent distress. The cardiovascular exam had no pertinent findings. He had a regular rate and rhythm, as well as distinct S1 and S2 sounds. In the respiratory exam, I did auscultate wheezing all throughout the lung fields. And indeed, when the patient did try and take a deep inspiration for my exam, it did exacerbate a cough each time he tried to take a very deep inhale. In the rest of the physical exam I did, there were no pertinent findings in the HEE and T exam. Everything there looked normal. So my only true findings were the wheezing all throughout and the coughing with deep inspiration. So as far as assessment goes, my thoughts on the patient is that he is experiencing acute bronchitis. My differentials are asthma, pneumonia, and common cold. The reason that I don't think it is pneumonia is because the patient is having a productive cough with green phlegm, but is having no other constitutional symptoms, fever, fatigue, anything else that really would be pointing me towards being very ill with a pneumonia. So at this point, I don't think that I need to look further into pneumonia and order a chest x-ray. Right now, it does not appear to be an infection like that. The same thoughts go with common cold. The patient, once again, is not experiencing fever, fatigue, rhinorrhea, no adenopathy, and given the fact that the patient does have wheezing all throughout his lung fields, that does point me more towards inflammation, meaning that it would probably be asthma or acute bronchitis. And the reasons that I think it is acute bronchitis rather than asthma are because this is the first time the patient has ever experienced these symptoms before. The patient also has no family history of asthma or does not have any allergies, which make the patient more at risk of developing asthma. In order for me to diagnose a patient with asthma, I would need to do more testing like spirometry or peak flow measurements, and I also think that the patient would need to have experienced a flare-up or difficulties like this on other separate occasions, not just a one-time, first time he's ever having these symptoms. So with that in mind, my assessment is that the patient is experiencing acute bronchitis. My plan for the patient is to, in office right now, give him one single dose of 12 milligrams of dexamethasone. This steroid will help decrease the inflammation that he is having in his bronchus with the acute bronchitis. I will also write a prescription for the patient for albuterol, 2 puffs 4 times daily for 7 days. This is a bronchodilator, which will help dilate the bronchus, eliminating the chest tightness that he's feeling, as well as making it easier to breathe, and will also reduce the bronchospasms, causing him to constantly have this coughing and uncomfortableness in his chest. As far as patient education goes, I would educate the patient to, since he is currently in football season and being very active, to also use the albuterol 30 minutes to an hour before his exercise to open up his airways, cause him to be coughing less when he's working out, and make it easier overall for him to be breathing. Also would educate the patient that if he is having that much trouble, he should probably rest and take a day or two off of football. And I can let him know that we can provide a note for him, a doctor's note saying that he does need to take a day or two off in order for him to get better and recover so that he can go back to his sports regularly. Also, a little bit of patient education about a home remedy is that he can make green tea, preferably decaffeinated, especially if he uses it at night, and mix honey and lemon into the tea as just a remedy to help break up any of the congestion and mucus that he has, and to also just alleviate any pain or soreness that he's having from his acute bronchitis, from coughing in his throat. As far as follow-up goes, I would tell the patient that if he is not starting to feel better or his symptoms are not improving within 2 to 3 days, he needs to either contact us or come back in for a follow-up, because he might indeed need to get more diagnostics done or possibly be put on an antibiotic if we start to become suspicious of it being a bacterial infection, whether or not that's bronchitis that's caused by bacteria, or if possibly there could be development of pneumonia or any other type of bacterial respiratory problem. So if the patient is not feeling better within 2 to 3 days, he needs to come back in for another checkup. And if he is starting to feel better, then he just needs to continue on with his albuterol for the full 7 days to make sure that he completely gets over the acute bronchitis. And just in case it is asthma, I would also give the patient the education of, if he starts to have these symptoms a lot over and over again at a constant rate, he definitely needs to come back in and get checked up so that we can do further testing to see if indeed maybe he has developed asthma.